There are 9 traits of borderline personality disorder. Here to go into depth about each one is clinical psychologist Dr. Ramani. Dr. Ramani, thank you for being here, clinical psychologist, and one of my favorite people to interview.
Thank you.
Because the topics that you bring are so fascinating.
They are fascinating. Everyone wants to know about them, but you're actually a fantastic interviewer too. So
well, thanks.
Thank
I
you.
was fishing for compliments.
Yeah,
so.
it works.
Today we're talking about borderline personality disorder. What exactly is that?
Borderline personality disorder is a disorder of instability and impulsivity, if you want to look at it that way. By instability, we mean instability in their relationships, instability in their moods, instability in their behavior, and instability in their sense of self. So the world always feels like it's sort of moving up and down for them. Finally, there's also a tremendous fear of abandonment that always cuts through this disorder. So people who have borderline personality, in addition to all of that instability, live in chronic fear of real or even perceived abandonment. For example, someone even showing up late to dinner, that could be experienced as a frank abandonment, and then their response to that is very strong, often very angry, very upsetting, not only for the person with borderline personality, but for the other people involved.
But I feel like we're all a little bit like that.
Here's the thing. I don't disagree with you. And the issue with all personality disorders is that they refer to an extreme of personality, in essence, okay? So do we all get thrown off if we feel like somebody's gonna leave us? Maybe to a degree, especially if we love or care about that person, but we also have enough of a sense of self to say, I don't want them to go, but if they go, ultimately I'll be fine, I'll cry it out for a few days. We don't feel like we're gonna die. We don't feel like we have to violently or aggressively or verbally assault another person. Most of us have a very solid sense of identity. We may shift a little, say, I don't know what I want to be when I grow up, but by and large, I know I'm Ramani. We know who we are.
That's right.
For a person with borderline personality, that's constantly shifting sand.
They don't have a strong sense of self.
They do not.
Okay.
They do not. In fact, we would call it identity disturbance. It's not unusual, for example, for a person with borderline personality to want to change their name sometimes, or completely change their look and cut off all their hair, or change a color, or change how they even dress. That identity disturbance can be presented in a lot of different ways. And it can be sort of throw other people off in their world, saying, I thought you had this name last week and now you have this name. So it can be confusing.
Now there are 9 traits that would define someone who has borderline personality. But before we get into those, how is BPD, borderline personality disorder, different than all of these other personality disorders?
So as of right now, and this will change over time, there are 10 personality disorders in the diagnostic manual we call the DSM, or the Diagnostic and Statistical Manual of Mental Disorders. There's also a different classification scheme called the ICD-10, or the International Classification of Diseases. I'm only making that technical point because people may run into that if they were to, for example, see a medical record.
Now, do you know if dissociative identity disorder, multiple personality is what it used to be called, is one of those 10?
Dissociative identity disorder is in a separate section of the diagnostic manual under a whole series of other dissociative disorders. And it is often misdiagnosed borderline personality. It's a very rare, DID is a very rare disorder. And many times people who are called DID, if you will, they actually have borderline personality.
Okay, so back to my original question. How does borderline personality disorder differ from all these other ones?
Borderline personality disorder is unique in the personality disorders for how unstable the emotional state of the person is. They will go from angry to sad to cheerful in the same hour. You will not see that kind of emotional instability with any other personality disorder.
Even bipolar disorder?
Bipolar is not a personality disorder. And frequently, borderline personality disorder and bipolar disorder get misdiagnosed by lay people. People who are professionals in the field know the clear difference. The difference between borderline personality disorder, which is a personality disorder, and bipolar disorder, which is what we call a mood disorder, just like depression. Bipolar disorder is characterized by something called mania. Mania is a period of time, it could last 4 to 7 days, even longer, where the person has this incredibly expansive, excitable mood, sometimes even irritable. They can go for days without sleep. They could talk, and not stop. They'll empty everything out of their garage and you're not clear on what's going on. They'll drive to Vegas with their life savings. They'll spend, they'll have sex, they'll become very disinhibited. But that goes on for days. Wow. They will not in one day have a crash. They will stay in that sort of high for many days, and it's quite debilitating. It's not unusual for a person during a manic episode to end up requiring psychiatric hospitalization.
Yeah.
The reason borderline personality gets confused with bipolar disorder is because the person's moods are fluctuating so much. But if the moods are fluctuating in one day, that's more indicative of borderline personality. That's the difference.
Our founder of MedCircle actually is very open, saying that he has bipolar 2 disorder. And it's one of the reasons he's so passionate about this company, to help people get on the website, sign up for that free email digest, to get the information that they need so that they can make healthier choices and be informed. Because like you said, an expert could decide if it's borderline personality, if it's bipolar, if it's all these other things. But me and most of the people watching, we don't know.
And it's that misconstrual is dangerous because the treatment for bipolar 1 or bipolar 2 is quite different than it is for borderline personality.
That's right.
And the fact of the matter is, you can have both of those disorders occurring at the same time, bipolar with borderline personality. And in fact, in the realm of mental health, that combination of disorders may represent one of the greatest treatment challenges we have in the field. It requires very, very intensive treatment for a long time.
Wow. All right. This is going to help me, and I think a lot of the viewers truly understand it. What are the 9 traits? Let's go through them.
Okay, so the first trait we'll see is fear of abandonment. That abandonment can be real or it can be perceived. And by perceived, I mean that the person will feel, I've just had an argument with this person, they're going to leave me. So they're always preparing for this abandonment, and in trying to prepare for it all the time, they almost make it happen. You're going to leave me. You're cheating on me. Who are you with? You're never coming back. And they do this, and they kind of grind the other person into the ground. And I don't just mean in an intimate relationship. This could be a friendship. This could be a family member. For example, it could even be a family member who says, hey, we're moving some of your stuff out of the garage because we're going to sell the house. That could easily turn a person with borderline personality disorder into a place where they're convinced that their family's trying to abandon them. Wow. That's what I mean by it can be real or perceived abandonment, and it often becomes a self-fulfilling prophecy.
Okay, what is the second trait?
Unstable and really intense interpersonal relationships. Now, obviously, this can be an intimate relationship, but it's any close relationship. These relationships often start passionately and closely, and they want to be with someone 24 hours a day. Then very quickly, there'll be very loud arguments that ramp up very quickly. There'll be intense passion, followed by intense anger, followed by lots of tears, and the relationships always have a roller coaster feel. Again, this can be a family relationship, it can be an intimate relationship, it can even be a friendship or even workplace relationships. Almost all of their relationships are characterized by this level of intensity.
Wow.
The third symptom we see is what we call identity disturbance. And by identity disturbance, we mean a person that almost literally doesn't know who they are. They might even ask that question out loud, I don't know who I am. And in that way, there is a chronic inside battle of who am I? Because if you don't know who you are, it's almost like you don't know how to go through the world. That identity disturbance can be manifested, for example, in a person chronically changing their appearance. Hair color, hairstyle, what they wear, tattoos, piercings, you name it, they'll change that. They might even change their name. There's a real lack of knowing who they are. In the extreme, this identity disturbance can sometimes even look like a multiple personality situation where they actually pop into multiple identities. One day they're one person. I'll say, today, baby person is here. They'll say, the next day they'll say, hey, it's me, I'm sexy such and such today. So they'll actually even sometimes have this sense of that these are different personas that they inhabit, but in general, their identity is really disrupted and chaotic.
Wow. All right, so that's 3. I already feel like 3 is 3 too many. I'm exhausted listening to those, and we're a third of the way there.
Yeah, we're a third of the way there. The fourth is impulsivity. Impulsivity is this idea of acting out or behaving in a way without thinking about it. So that could be manifested by oftentimes rather dangerous or problematic behaviors. These things could be substance use, binge eating, binge spending, gambling, impulsive sexual behavior. For
and
example,
when you tell me all these
sex
things,
with
that
strangers.
sounds like a manic episode.
It can, but see, here's the thing. With the manic episode, that mania stays consistent
Right,
for several days.
And borderline personality disorder could be hours.
And could be hours. So they'll act out at the moment. So that's where, for example, it wouldn't be unusual to see a borderline personality disordered individual finding themselves in major financial trouble. Because when they're feeling like they want to soothe their mood, they'll go out and shop and shop and shop. It's not unusual, for example, to see a substance use diagnosis coexisting with borderline personality, because in some ways they use it as a tool to soothe. So it's this acting out without thinking about it, not thinking about the ramifications of the behavior, and oftentimes it's a way to sort of soothe the mood at the time.
Yes.
But it can be quite dangerous for the person.
And while they're doing that, they're not addressing the problem. These are all Band-Aids.
They're all Band-Aids, but at the moment they're not thinking of it even as a Band-Aid. It's almost like the sense of, I don't want to feel this way, so I'm going to do something. So in the short term, it actually feels like a good strategy.
Right.
Now I feel different.
Yes.
Isn't this great? Without thinking like, whoa, I just spent $5,000 that I don't have.
That's right.
Right.
Yes. Okay. All right. What is the fifth trait with somebody who has borderline personality disorder?
The fifth trait is actually a rather dangerous one. This is where we often see recurrent suicidal behavior or suicidal thoughts. People with borderline personality disorder have relatively high rates of suicide attempts. Now, these suicide attempts may be a way at times, for example, to avoid that sense of abandonment. I'll show you. You think you're going to leave me? And they'll harm themselves. So that will draw the person back, trying to keep them safe.
It's the person saying, if you leave me, I'll kill myself.
If you leave me, I'll kill myself. Or they'll call a person while they're in the midst of taking pills or harming themselves and saying, hey, I just want you to know this is what I'm doing. Most other human beings would come to their side. Now they haven't been abandoned.
Of course.
This also can manifest in other behavioral patterns. For example, you might see cutting. So a person may cut their arm. Now that it's considered sort of a suicidal gesture because that could ultimately harm them, or a self-harming gesture. So that all falls in that place. But like I said, this can be dangerous because even if the person with borderline personality disorder didn't, if you will, intend to die, they were actually using it as a cry for help, it can go too long. For example, they may actually take too many pills and it would be too late. They may actually attempt to hang themselves and actually hang themselves or strangle themselves. So this is where it becomes a very dangerous disorder from a management perspective. And again, it's often a response to this inner pain that they feel like they cannot manage. It's almost as though in that moment, they want to be alive, but at the same time they want to be dead because they can't manage that pain. And that's a lot of that borderline back and forth.
I want to take a moment just right there to tell the viewers that if they themselves ever feel that way, to the bottom of this video there are links to the suicide prevention hotline. And if you know somebody who may have, up at this point, these traits, make sure you go to MedCircle.com and utilize those free resources and get on the digest for borderline personality disorder, because this is always changing. We're always learning more, and the first step is to know about it. That's the first step. That's why you're watching this video, because you want to know about it. Now the next step is to go in deeper and really keep that education up to date. So when you say stuff like that, where we're actually talking about a potential life and death scenario, I want people to know that there are resources out there. That's why we do this. That's why we're here doing this. MedCircle.com, that is your next step. What is the sixth personality, or the sixth trait of someone with BPD?
The sixth trait is something we call affective instability, which is a fancy way of saying their moods are sort of all over the place. That's where we can see those mood shifts in even a couple of hours, going from angry to sad. So it's this affective instability where moods can shift and fluctuate in a very short period of time. So the person will feel, For an individual with borderline personality disorder, it's as though they always act in line with their emotion. They don't stop to inhibit it. And that's a big issue in borderline personality, which is almost saying, I'm having a feeling, I can manage this feeling. It's as though they feel, it's like a tidal wave. It takes them over. If they feel angry, they express that anger strongly. If they feel sad, they express that anger.
Wow,
they
I think I
express
have the
sadness
opposite
quickly.
problem of that. I think when I feel angry, I go, nope, I'm not going to show anybody.
Yeah.
Or if I feel sad, I go, no, no one's going to know I'm sad.
And this is the opposite of it. So it's that mood instability is actually a very classical part of the borderline personality presentation. And it's what sort of plays into all of these other traits, because if somebody their moods are always up and down, of course their relationships are going to be all over the map. If their moods are always up and down, you can see how they don't have a stable sense of self. So it's a key hallmark of this disorder that their moods are all over the place and they have a lot of difficulty regulating those moods. And it's here where you can also see that this becomes a very difficult disorder to manage, and it's also why a lot of people confuse it with others. It's also why other people confuse it with other disorders like bipolar disorder.
That's right.
Because of that misunderstanding that bipolar means moods are all over the map, not in the same day. And that's what you see in borderline personality.
Wow.
They overreact to everything that's happening in their environment. It's as though they're hyperreactive, whereas a person might react to anger with this much of a blip up, a person with borderline personality will go all the way up to here. And that hyperreactivity is the core of one of the big cores of borderline personality.
Yes. Okay, what number does that bring us to? Number 7. So we have 7, 8, and 9 to go.
Okay. Number 7 is that the person with borderline personality chronically feels empty. So they'll often report, I feel like there's nothing inside of me. I feel like a drum. I feel like a hollow shell. Now, if anyone feels empty, what do you think they want to do?
Fill it up.
They want to fill that emptiness up. And for a person with borderline personality disorder, that filling up either happens through other people or inappropriate ways of regulating it, like shopping, spending, eating, something to fill in that sense of emptiness. But imagine that the psyche of a person with borderline personality disorder almost has a little hole in the bottom. So whatever they put in is coming right out. So they're always struggling with that sense of, I need to feel whole, I need to feel whole. And they look to the outside world to fill them. Whereas for the rest of us, we do feel whole inside. There may be days that are harder for us, but we feel a whole sense of it. If something, imagine like an endoskeleton, like something that supports us from the inside. If we don't have that, we collapse. So the person with borderline personality, it's as though they sometimes don't fully have that psychological skeleton within them. So they often do feel as though they're collapsing and they feel empty. It's a very panic-inducing feeling for them too.
Yeah, it sounds like it.
Number 8 is another symptom that causes a lot of interpersonal difficulty because it's manifested by inappropriate and intense shows of anger. So when anything frustrates them, and it can even be what seems like a very small, slight kind of thing by other people, they will blow up. And not just verbally, but quite frequently physically. They'll throw things, they'll become physically combative, they'll become assaultive, but they'll scream and yell, and the show of anger happens so quickly, and that's what throws people off. It's very quick, and it's very intense, that it terrifies everyone around them. Adults, children, family members. And so as a result, people will say because of this particular symptom, they often walk on eggshells around the person with borderline personality because they're so afraid of angering them and that there'll be this big disproportionate volcano of anger. So over time, everyone is just like being very, very careful around them. But the fact of the matter is, in fact, it's beautifully said by some of the researchers in this field that people with borderline personality disorder have this really, really thin skin. So they feel everything. And they overfeel it as a result. And so they become hypersensitive to all of these stimuli in their environment. And more often than not, they react with anger.
I've seen that reaction from pets. Pets who
that's
get around
interesting.
a certain person and immediately their body language changes.
Yeah.
And I said, what is going on with this dog? And they said, oh, well, you know, Mark just freaks out over the littlest thing. So when the Rover's around, he gets really nervous. You know, picking up on that.
Yeah.
I don't know what he's going to do because
Right,
it's
right.
so the slightest thing can happen.
So you could see now, jump that to a person. And for a person, that can happen in all situations. Then what we see on the back end of this is that after a person with borderline personality has these strong shows of anger, they feel really regretful about it. They feel bad
The
about
borderline personality disorder, the person who's been diagnosed with that, when they have these bursts of anger and they come off of that, they feel remorseful.
Not only remorseful, then they're terrified because they're like, everyone's going to abandon me now.
Yeah.
You see how it becomes a cycle. It's a huge cycle. So there's a lot of embarrassment, humiliation, frustration with themselves, and then what they do, that anger they had out, now they have it at themselves. They get angry at themselves, and what could happen then? A greater likelihood of self-harm. So what borderline personality is, it's lots of emotional loops that keep playing out to the detriment of the person with the disorder as well as the people around
And
them.
on a small timeline. I mean, within a day or so.
Oh, within an hour.
Oh my gosh.
And you don't know what's going to set the person off. It could be a glance that's the wrong way. It could be missing the color of their dress or noticing the color of their dress. You just don't know. And this is why for family members or loved ones or co-workers of individuals with borderline personality disorder, they often don't know if they're coming or going, and they feel like they're living in an alternate universe, and they often blame themselves, saying, how could I do this differently? The answer is there's not much you can do.
Well, we're going to talk about some things that they can do, or at least cope and survive through this in a little bit, but what is the final trait of someone who has BPD?
This last trait is actually relatively severe when we do see it. The technical term for it is transient stress-induced paranoid ideation, other psychotic symptomatology, or even dissociative symptoms.
I have no idea what you just said.
It's a fancy way of saying that under stress, particularly significant stress from time to time, a person with borderline personality disorder may experience frankly paranoid symptoms, really believe other people are out to get them or harm them, a sense of conspiracy. They may actually hear voices, but the voices are very much negative and harmful, and they're scared of them. So they'll literally look psychotic. And in fact, if they were seen at that moment in time, a mental health practitioner might actually think they're psychotic. It's just they're skirting the surface of it.
What do you mean they look psychotic?
They look like they've broken off from reality. That they almost look like they're delusional.
They're saying, I see people, or people are getting
It might very well be that, I hear my mother's voice that's talking to me, she hates me, why does she hate me? Or it's that everyone's out to get me, or I know it, something terrible is about to happen, that kind of thing. It's and they're very firm in their belief. In addition, included in this last trait or symptom is this idea that people with borderline personality disorder can sometimes experience what we call dissociative identity, or symptoms of dissociation. In those cases, they may actually break off and start behaving like a child, and you're convinced they're a child. Because of that, when we see that dissociative pattern, when I've seen it clinically, I've seen an adult woman in my office literally take on the posture of a 4-year-old child. This was years and years ago, but it will always stay with me that, wow, she just became something else. And it was then, in that moment, I learned about how borderline personality disorder can look a lot like dissociative identity disorder, something that's popularly termed multiple personality disorder. Because under severe enough stress, you will see them dissociate into what feels like another personality, but it's all subsumed under the borderline personality disorder, and it requires a lot of assessment to differentiate the two.
Recently, I interviewed a woman named Encina who has 11 personalities. During that interview, we'll link to it below this video, she went into one of her alters, which was a 3-year-old girl. And it felt like I was talking to a 3-year-old child. I did not feel like I was talking to an adult pretending like she's a 3-year-old child. I was like, oh, this is a 3-year-old girl. So I can very easily see how borderline personality disorder and DID, or multiple personalities, would be confused.
And then you'll see that what you'll see in a person with DID, they may not have as much of the emotional instability, the anger, all of those other symptoms, the fear of abandonment, that may not be presenting there. That's a lot of how we sort of sort those two out, but it takes time. You're not going to decipher this at the first pass with someone. That's why we need to see people a few times for assessment to really be definitive in the diagnosis we give them. And diagnosis really is a tool to drive treatment. That's its function, not to label someone.
Do you have to have all 9 to get the diagnosis?
5 out of 9. 5 out of 9. And classically what we see are the fears of abandonment, the interpersonal issues, the difficulties with regulating emotion, and then the other stuff can pop in and out. And in fact, there are theoreticians out there. Theodore Milan was a really important personality theorist, and he argues that there's actually subtypes of borderline personality, that there are some borderline personality individuals who are more depressed. There are some that are more acting out. There are some that are more petulant and throw tantrums. And that each of those styles of borderline personality may require different kinds of treatment.
For the people who believe that they have someone in their life who has borderline personality disorder, what is your advice to them?
In any way possible, try to get that individual into therapy, because there are therapeutic models that can help the person with borderline personality manage some of these strong reactions. The challenge is that the form of therapy you need to do with them is really almost lifelong and pretty regular, like multiple times a week. So it gets challenging from a cost basis, to be honest with you.
How do you approach somebody
very difficult.
who will go off on the littlest thing?
The best way to start is not to approach a person who has borderline personality on the you're all over the place and you're acting crazy or something like that, but rather maybe focus on one of the other, what we call comorbid symptoms. Something that's causing a lot of distress for the person with borderline personality. For example, they may be depressed, they may be anxious, they may be having problems with spending or eating. Make that the treatment target to get them in the door at least, and then a skilled therapist should be able to see this pattern. The treatment of choice that has been shown consistently by the evidence base to show the best success outcomes with borderline symptoms is a treatment called Dialectical Behavior Therapy, or DBT. With DBT, the person not only gets regular therapy, they also kind of get lots of regular follow-up, almost on a daily basis, and they work in group therapy to almost learn how to work with other individuals. So it's very intensive. But if a person can get their loved one into that form of therapy in a holistic manner, you may actually get them to a place where they're more safe, that maybe you're running on a more even keel within your family system, but it is a lifelong commitment. This isn't a one-off. You've got to be committed to this model of therapy in the long term.
Well, this is all great information as a starting point for people who are interested about this topic. We're going to talk in our next video about what causes this initially, and also some more treatment options. Dr. Ramani, always so insightful to have you here. Thank you.
Thanks.
Thanks for watching. Your next step is to head on over to MedCircle.com and sign up for the MedCircle Digest. What is it? Well, MedCircle will send you the latest articles and the latest videos on the mental health topics that matter most to you. So go to MedCircle.com, sign up for that digest, and let's keep this journey on better mental health moving forward.